summer's almost here. We're going to spend a lot of time outdoors. And doctors are always cautioning us to, to cover up, to use some sort of a sunscreen because there's a worry about skin cancer and melanoma. But did you know that the sun can have a harmful effect on your eyes as well? Dr. Gulani from the Gulani Vision Institute here in town is getting ready to travel abroad to share his innovations at the World Conference next week. He's going to talk about them here first on the morning show. Dr. Gulani, always a pleasure to see you here.
Good to see you, Bruce.
You know, people don't stop and think about it. Eye protection is necessary because the sun can have a very damaging effect on your vision and on the health of your eyes.
Yes, of course. What can happen to your eyes is because of sun exposure, you can have a condition called Pinguecula Pterygium. You have this yellowish-red growths on the white of your eyes, and that compensates more and more with more exposure. And beyond that, you can also develop cataracts, or actually accelerated beyond your age. That's also an important reason to have sun protection.
So like with skin exposure to the sun, sometimes the impact of the sun on your eyes may not be seen for years to come. So you cover your body with sunscreen and sometimes protective clothing. Cover your eyes out there as well.
With sunglasses, yes. And then if you do have the condition, there's a unique surgery that we do. It's a no-stitch human placenta surgery that makes your eye looks absolutely fine. Again,
fantastic, fantastic. Now you're traveling to Germany for a world conference, and you're going to unveil some innovations there. What are you going to be talking about?
Actually, I'm going to talk about quite a few things that I do here already, which is advanced laser surgery, advanced Lasik, where we're not even cutting the cornea anymore, not using any blades, so it makes it more safer. Even people who are told they are not candidates like astigmatism, thin corneas, they can also have Lasik today. The other thing I'm sharing there is advanced cataract surgeries, again, that we are already doing here in Jacksonville, providing lens implants with cataracts where people do not need glasses in most cases for distance or for reading. So cataract surgery is also raised to a new level. I'm also excited to be looking into new technology using lasers in cataract, Bruce. This was the hottest topic when I was teaching in Boston last month at the national meeting. So I'm very excited because, as you know, Germany does produce some of the most advanced technologies in our field, in ophthalmology. But to test them and evaluate them and then bring them back to our practice, it's a pleasure.
When you take some of these advanced technologies to your peers, do they seem surprised at how far we've come when it comes to the techniques and how much better they are for the patient?
Absolutely, because all of us, Bruce, you know, I teach a lot too, that's a passion. It's like a common passion. When you do something unique, advanced, we love to share that with other surgeons, and this way the complete fraternity benefits and the patient's benefit as an endpoint user, absolutely.
So the patient benefit is probably twofold. Number one, a healthier outcome, and less pain, less discomfort, less time to recuperate and recover and get back to a normal life.
Yes, absolutely. So raising vision to beyond 20/20, first goal. Safety of the surgery, so everybody can have it and there's less complications, and long-term stability. These are the three goals of any innovation in eye surgery that I propel.
Less complications, less risk as well?
Less risk as well, absolutely. More safety, less risk, less complications, higher predictability of our ability to say, okay, if I do your LASIK or advanced cataract surgery, you'll have this endpoint. That's a great outcome of technology.
Got about 30 seconds, and I want people to know, because they got a lot of questions out there, they actually have a chance to ask their questions of you in what we call a webinar. It's like a live broadcast on newsforjax.com, and the first one's going to be next Thursday.
June 24th, actually.
June 24th, okay.
When I'm back from Germany.
Oh, the last Thursday of every month is when we're going to do it.
Sure,
all right.
Sure.
So they can just go ahead and email the questions. It's the last Thursday of every month, as Dr. Gulani said, starting June 24th at 12:30. You email your questions to Ask Dr. Gulani at newsforjax.com, and then the doctor's in the house here on the local station. Dr. Gulani, always a pleasure. Safe travels.
A pleasure again. Thank you, Bruce.